Welcome to Health Chat, presented by Phoenixville Hospital. We're talking today with Dr. Reis and Dr. Dhawan. They're the co-directors of the Cardiac Catheterization Lab here at Phoenixville Hospital. To begin, I wonder if you could explain what a Cardiac Catheterization Lab is.
Sure. Well, Robin, we're sitting in a cardiac catheterization laboratory now, and this is a place where we have specialized equipment that allows us to do procedures to diagnose and treat heart disease as well as disease in the blood vessels elsewhere in the body.
Well, what specific procedures are done here in the lab?
We not only perform cardiac catheterization, but we also do peripheral diagnostic cardiac catheterization, which means taking the pictures of the arteries, going to the legs in case the patient have the symptoms, and also taking the pictures of the arteries going to the kidneys and also to the brain. And if the blockages are found, then we try to open those arteries with a balloon and put a stent inside if necessary.
So what can a patient expect when they're undergoing cardiac catheterization here at Phoenixville?
Patient coming in as an outpatient would check in across the hall in our same-day procedure unit. Procedure would be explained, they would get some medicine to help them relax, and then be brought over here, be placed on the table, covered in a sterile drape and given a local anesthetic, similar to going to the dentist. When you, once the anesthetic is given, a tube is put in, usually through the femoral artery in the groin, and then passed up to the heart. The procedure of taking the pictures, diagnosing the disease takes about 20 or 30 minutes. If we would fix something, do an angioplasty or stent, it would take somewhat longer.
Are cases mostly elective or emergency?
About 70% of the cases are elective cases, which means that the patient has been having some chest pain or shortness of breath last few days to weeks, and the stress test was performed in the cardiology office, and the patient has come for a scheduled case over here. The other cases are emergent cases, which we provide 24 hours a day, 7 days a week. The patient has come to the emergency room with a sudden onset of chest pain, and we perform that procedure immediately. Then there are certain cases in between in which the patient has been having ongoing chest pain for last few hours or maybe for 24 hours, and we perform that procedure on an urgent basis in the hospital.
So what advantages do patients have in coming here to Phoenixville rather than other facilities?
I think there's two advantages. The first one is Phoenixville Hospital is here in the community. It's convenient to patients, their friends, their family to come here, and many of the staff in the hospital and in the Cath Lab live right here in the community. They're part of it. The second advantage is that here at Phoenixville Hospital, the procedure is done from beginning to end by physicians such as Dr. Dhawan and myself, who have many years of experience in performing these. In a Center City hospital, it's a teaching hospital, so the procedure is being done by someone learning to do it under the supervision of an experienced physician. But that's hands-on experience, which is necessary in order to teach. But again, here, from beginning to end, the procedure is done by someone who's been there, done that, and has all the experience.
Very good. Thank you, Dr. Reis and Dr. Dhawan. You've been watching Health Chat, presented by Phoenixville Hospital.